Alright, so our topic for today, the last of the pharmacology topics, it's the endocrine drugs. So these drugs are drugs which all affect the hormones secreted by the different endocrine glands. There are several endocrine glands, but only these five glands will be involved in the discussion of the endocrine drugs. So what you need to review are the different hormones secreted by these different endocrine glands, as well as the functions of each of the hormones na sinisecrete nila. So basically, the drugs that we will be discussing are those drugs which affect these hormones. In what way? So una, maaaring ang mga gamot na ito ay minimimic or ginagaya, nire-replace yung hormone. Pangalawa, it could block the action of the hormone. Pangatlo, maaaring mag-increase yung function ng hormone. Pang-apat, maaaring mag-decrease yung function ng hormone. So, it basically affects the overall functioning of the hormones of these glands. Alright? Let's begin with the pituitary gland. Si pituitary gland, siya yung endocrine gland na may pinakamaraming sinisecrete na hormones. The anterior and the posterior pituitary gland both secretes different hormones, but we will only be discussing 4 of its many hormones. Growth hormone, thyroid-stimulating hormone, adenocorticotropic hormone are all hormones of the anterior pituitary gland or the adenohypophysis. On the other hand, si antidiuretic hormone, siya naman yung isa sa mga hormones ng posterior pituitary gland or the neurohypophysis. So again, we will be discussing drugs which affects these hormones coming from the pituitary gland. First, the growth hormone. Problems affecting the growth hormone affect the growth. So basically, kapag ikaw ay merong growth hormone deficiency, maaari kang magkaroon ng dwarfism. No? Usually, ito ay nadadiagnose during childhood. Kapag naman meron kang growth hormone excess, maaaring meron kang gigantism or acromegaly. Yung gigantism usually, again, diagnosed during childhood. Pero yung acromegaly, maaari kang magkaroon nito dahil even with adulthood. Alright? So if you have growth hormone deficiency or if you have dwarfism, you can be given somatrem or somatropine. It's administered before epiphyses are fused. The epiphyses of the long bones, sila yung nag-elongate para ma-achieve ng isang tao yung maximum height niya. Alright? And usually, epiphysis closes during childhood period. Kaya pagtanda mo, yun na yung maximum height na na-achieve mo. But administering this growth hormone over several years will not give you the maximum potential height supposedly. Mag-i-increase lang ang height mo maximum by a foot. Alright? Prolonged therapy can antagonize insulin secretion. So, you know the disadvantages associated with problems of insulin, and it's contraindicated in children who are severely obese and with severe respiratory impairment. Of course, when you are giving somatrem or somatropine, it's very important that you give the child or you provide important diet therapy, no? Also, importante na minimeasure lagi yung growth. So, laging i-check yung height, including na rin the weight. For growth hormone excess naman, it can be used alone or with surgery and radiation. Bakit surgery and radiation? Because most often, reason for gigantism or acromegaly is because of a brain tumor. So, yung brain tumor, nako-compress niya yung pituitary gland, which in turn affects excess secretion ng growth hormone. Kaya pwedeng gamitin ang bromocriptine mesylate or octreotide acetate with surgery or radiation for the brain tumor. Kasi kahit nabigyan mo yung patient na merong growth hormone excess ng mga gamot na ito, if you do not treat the underlying cause, which is the brain tumor, uulit lang ng uulit din yung growth hormone excess. So these drugs can also cause GI effects. So again, you know very well that if a drug causes GI effects, it's important to take the drug with food. It can also be used for severe diarrhea caused by carcinoid tumors. So meron siyang effect doon sa peristaltic movement ng GI system or the GI tract. The next group of hormones are the thyroid stimulating hormone. Now, si thyroid stimulating hormone ay hormone na nagsistimulate para mag-secrete ang isa pang endocrine gland ng hormones niya, which is thyroid hormones, specifically T3 and T4. Therefore, yung thyroid stimulating hormone will address directly or indirectly the problems involving the major thyroid hormones T3 and T4. Pero hindi siya yung mismong T3 and T4 na hormone. Alright? But only the TSH stimulating T3 and T4. Ano ba ang function or purpose ng thyroid hormones? They are very important hormones for metabolism, growth and development, may kinalaman din siya for reproduction, and even resistance to infection or the immune system. Alright? So, ano ngayon yung nagre-replace o isang purified extract ng thyroid stimulating hormone? Yun yung thyrotropine. Thyrotropine is not an extract of T3 and T4. But because of TSH or because of the thyrotropine, which is mimicking TSH, of course, nasa-stimulate yung T3 and T4. Kaya pwede siya for diagnosing and treatment of thyroid problems such as hypothyroidism and thyroid cancer. Again, lahat ng mga nadidiscuss ko na mga medical problems, medical, surgical, nursing concerns ay madidiscuss nyo further sa medical, surgical nursing. So I'm just giving a brief background of these disorders so that you will be able to understand para saan ang mga gamot na ito specifically. Thyrotropine can be given sub-Q or IM, and again, bakit ulit may radioiodine following last injection? Because, again, ang mga problema involving thyroid gland may also involve growth of tumors or cancers. Alright? So, dahil nga may compression doon, may bukol doon, maaaring nasa-stimulate ulit yung TSH o pwedeng dahil din sa bukol, kaya hindi siya nagsisecrete ng maayos. So, maaaring dalawa ang dahilan o dalawa yung pwedeng mangyari sa mga compression ng endocrine glands. No? Una, maaaring dahil doon sa bukol, nagkakaroon ng insufficient production of hormones. Pangalawa, dahil dun sa bukol, nagkakaroon naman ng excessive secretion ng hormone. So sa pagkakataong ito, as you can see, there is hypothyroidism, so which means probably because of another pituitary gland tumor or tumors near the pituitary gland in the brain. It can affect decreased stimulation doon sa thyroid gland para insufficient. That's why insufficient din ang secretion niya ng T3 and T4. So yun yung naging cause. But indirectly, it's because of the TSH problem from the pituitary gland. Alright? So, yun ulit yung ibig sabihin ng radioiodine concerning tumor growths or abnormal growths. Next is Adenocorticotropic Hormone. So, ang Adenocorticotropic Hormone ay galing naman sa adrenal glands. No? Ang sinestimulate naman niya ay adrenal glands. Kung ang TSH, sinestimulate niya yung thyroid gland, si ACTH, sinestimulate naman niya ang adrenal glands. Alright? At si adrenal glands, may medulla, may cortex. Medulla, hormones niya, epi and norepi. Cortex, hormones are glucocorticoid, mineralocorticoid, sex hormone. But specifically, ACTH from the pituitary stimulates the cortex to secrete the following hormones. So again, problems involving ACTH from the pituitary will affect the hormone secreted by the adrenal cortex. Alright? Ang pinaka-importante sa lahat, ay ang cortisol. This is very essential to life. Cortisol is a glucocorticoid. And again, it is important for metabolism ng nutrients. It maintains fluid and electrolyte balance. It assists with inflammation and pain, so immune system, sensation, and it operates on resistance stage of the stress response. Specifically, yung pag-activate ng sympathetic nervous system. Alright? Ngayon, dahil sa ACTH, nasa-stimulate ang pag-release ng cortisol. And cortisol is actually a major steroid of our body. Corticotropine is a drug which mimics ACTH. Alright? It's a drug given as an IV. It increases cortisol level. So, corticotropine mimics ACTH from pituitary, pero yung cortisol ang ini-increase niya for the adrenal cortex in 30 to 60 minutes, and it's also given sub-Q or IM. It can diagnose adrenal gland problems. Again, it can treat adrenal gland insufficiency kasi nga pag stimulate siya ng ACTH, which is corticotropine, synthetically, mas-stimulate yung cortex to produce more cortisol. It can also act as an anti-inflammatory drug in allergic responses, and it can also decrease symptoms of multiple sclerosis. Multiple sclerosis is a neurologic disorder which involves, again, inflammatory reactions. Right? What are the side effects of these drugs? Nausea, vomiting, increased appetite, mood swings, petechiae, sodium water retention, hypokalemia, and hypocalcemia. So, kapag medyo matagal tinitake ng patient ang gamot na ito, marami tayong watch out for. Also, remember that this drug may increase ulcer formation, especially if you take it with aspirin, which is an NSAID. These may also decrease the effects of oral hypoglycemics or insulin. So, cautiously given for people with diabetes. The next or the last group of drugs affecting pituitary gland hormones are drugs which affect the antidiuretic hormone. Alright? Ngayon, ano ba ang diabetes insipidus? If you are diagnosed with diabetes insipidus, you have an ADH deficiency. Alright? Antidiuretic hormones target organ is the kidney. And what does it do? From the word antidiuresis, it decreases urine production. Therefore, ADH increases blood volume. Alright? Ngayon, kapag meron kang ADH deficiency, dumadami yung urine output mo. Kaya, bababa yung iyong blood pressure. Alright? The reason why these drugs are good for diabetes insipidus is because basically they act to compress the blood vessels because ADH increases blood volume which compresses the blood vessels. Alright? Yun yung vasopressin or pitressin. It's a short duration of action, 2 to 8 hours, intranasal, sub-Q, and IM. Maaari din ito sa mga bleeding disorders or intestinal distension. No? Why? Because they compresses blood vessels. Pero pag longer duration of action, pwedeng ibigay ang DDAVP. Desmopressin acetate, longer duration of action, 15 to 21 hours, intranasal. At dahil long duration of action siya, pwede siya sa hemophilia type A, which is a type of congenital, no, chronic, or sex-linked recessive trait na bleeding disorder, which is hemophilia, na commonly seen among the males. Alright? Ngayon, ang vasopressin, important to take note that ang side effects nito is GI distress din, plus, of course, meron kang decreased urine output. Kumukonte ang iyong urine output, alright, which is normally 30 to 60 ml per hour. Kaya adverse effect niya yung water intoxication. Ang dami mo ng tubig sa loob ng katawan. Okay, important to check blood pressure. The next endocrine gland that we will consider now is the thyroid gland. Again, nabanggit natin kanina that the thyroid gland secretes T3 and T4 hormones. T3 is triiodothyronine and T4 is thyroxine. These are two major metabolic hormones, but between the two, T4 is our major thyroid hormone. T3 is a more potent one. Kapag may hypothyroidism ka, you have insufficient thyroid hormones. Pag meron kang Graves' disease, it's a form naman of hyperthyroidism. Alright? Both, again, ay maaaring dahil din sa mga bukol, no? Maaari, pero hindi laging ganon. Dahil may bukol, it's either ayaw mag-secrete or sobra-sobra ang secretion. And because of the glands action, no? Una, sa hypothyroidism, ayaw niyang mag-secrete. So, nagko-compensate si thyroid gland to secrete, maaring magkaroon ng goiter. Doon naman sa hyperthyroidism, sa sobrang secrete niya, lumalaki din yung thyroid gland. Kaya maaring meron ding goiter or enlarged thyroid gland. So, ang pagkakaroon ng goiter ay hindi lang laging hyperthyroidism. Maaaring meron din nun sa hypothyroidism. Okay? Now, ito ngayon yung gamot that will specifically mimic the action of the T3 and T4 hormones. Okay? Kanina ang diniscuss lang natin previously are the drugs which mimic TSH na maaaring mag-stimulate ng thyroid hormones. Pero ito na mismo si thyroid hormones, levothyroxine. Okay? Mixed edema is hypothyroidism among adults. Cretinism is a hypothyroidism in children. No? Cretinism ay maaaring magkaroon yung bata ng both motor and mental retardation. Lalo na because of congenital hypothyroidism, that's why newborn screening is very important. Because newborns born with hypothyroidism look normal. But along the way, nagkakaroon na pala ng problem, hindi na-address agad yung situation. Okay? Now, levothyroxine is given per ORM and IV before meals for best absorption. It increases metabolic rate, oxygen consumption, and body growth because it's a metabolic hormone. Kaya ang side effects niya, nausea, vomiting, diarrhea, cramps, tremors, nervousness, insomnia, headache, and weight loss, usually because of increased metabolism. Okay, adverse reactions include tachycardia, hypertension, palpitations, again, because of increased metabolism. So, yung increased effects nito, no, oral anticoagulants, it decrease digitalis, it decrease oral hypoglycemics, and insulin. Avoid foods that also inhibit thyroid secretion, such as strawberry, peaches, pears, cabbage, spinach, cauliflowers, radish, and peas. Okay? Now, totally the opposite of hypothyroidism is hyperthyroidism. Actually, ang dalawang sakit na ito, medyo madali silang i-differentiate sa isa't isa. Kasi sa hypothyroidism, usually merong cold intolerance yung patient. Sa hyperthyroidism, may heat intolerance. Sa hypothyroidism, may weight gain. Sa hyperthyroidism, may weight loss. So, medyo opposite yung mga signs and symptoms niya. No? Graves' disease and thyrotoxicosis are forms of hyperthyroidism. So ano ngayon yung mga gamot para this time ma-block naman ang action ng thyroid hormones? Propylthiouracil or PTU inhibits conversion of T4 to T3. Why? T4 is the major thyroid hormone, pero mas potent ang T3. Okay? Ngayon, kaya ayaw na natin ng masyadong maraming T3 sa katawan yung taong yan. Dahil mas potent na nga yung T3. And to have T3, kino-convert ni T4 yung sarili niya to become a T3. So, PTU inhibits that. Again, it can be used before surgery or radioactive treatment and palliative control of toxic goiter. Nabanggit na naman dyan yung mga radioactive treatment, surgery. Again, sinasabi ko nga, no, baka kasi merong thyroid cancer or mga growths from within the thyroid gland. Methimazole or tapazole is another drug which this time it inhibits the actual synthesis of the thyroid hormones, both T3 and T4. Onset is 1 week, causes urticaria, headache, and GI upset. So, ang mga gamot na ito, no, adverse effect nito, agranulocytosis. And this can cause a weak immune system. Alright? Watch out for signs of infection. So, make sure that the patient is preventing the risk na magka-infection siya. Because when you say agranulocytosis, nagkakaroon ng destruction ng granulocytes of the white blood cells, which is yung neutrophils, eosinophils, and basophils. Ano yung maaring makita nating sintomas pag may ganun ang adverse effect yung patient from this drug? Fevers, chills, sore throat. So pag gano'n, no, magpa-throat culture, no, baka may serious drug effect na siya. Okay? Nursing considerations, give it per orem with meals. Increase anticoagulant effect and decrease effect of, again, oral hypoglycemics and insulin. Digoxin and lithium increase the action of thyroid drugs. Phenytoin, which is an anti-seizure drug, increases T3. Now, strong iodide solution such as Lugol solution and potassium iodide solution, these solutions can help reduce the size and vascularity of the thyroid gland. These drugs, or these solutions, are for goiter itself, to decrease the size of goiter. Its effect is about 10 to 15 days, which is to be given after meals, and it must be sipped through a straw. Okay? Meron pang isa, no? Sodium iodide. Meron din ganon. Ito naman, pwede siyang ibigay to a client, usually NPO overnight. So, yung mga iodine solution na ito, again, is for the goiter. Pero yung mismong drug that inhibits or stimulates the thyroid hormone, yun yung mga drugs mentioned kanina. The next is drugs affecting the parathyroid hormones. So, ang parathyroid gland, these are 4 small glands near to, attached to, or embedded in the thyroid gland at the back of the thyroid gland. It secretes a polypeptide substance which is PTH or parathormone. Ano naman ang function ng parathormone? Parathormone controls calcium level in the blood. And what does it do? It increases calcium level in the blood. Saan ba tayo nagtatago ng calcium? Majority sa buto. That's why it increases resorption of bone, thereby maintaining normal serum calcium levels. Bukod doon, it stimulates kidneys and intestine to absorb more calcium. If you have hypoparathyroidism, you have decreased parathormone or parathyroid gland. If you have hyperparathyroidism, you have increased parathormone in your blood. Okay? Now, let us now go a little back to another thyroid hormone, which is thyrocalcitonin. Why did I include this? Because thyrocalcitonin, the third of the thyroid hormone, aside from T3 and T4, is a hormone which now is somehow related to parathormone. Magkabaliktad ang function nila. If parathormone increases calcium, thyrocalcitonin decreases calcium because it causes calcium to be deposited this time in the bones. So it's made by parafollicular cells, so connective tissue between follicles. So again, opposite yung function niya ng parathormone, kaya naipasok natin dito ang parathormone or ang thyrocalcitonin, I mean. And again, yung effect niya when we talk about calcium balance is minor compared to that of parathormone. Parathormone increases calcium, thyrocalcitonin decreases calcium. Parathormone is from the parathyroid gland, thyrocalcitonin is from the thyroid gland. Between the two, mas major ang parathormone when it comes to calcium balance. Okay? So ngayon, kung meron kang hypoparathyroidism, ito yung mga drugs. Calcifediol, calcitriol, dihydrotachisterol, and ergocalciferol. So these drugs will increase your parathormone level to increase your calcium level in the blood. Ang hyperparathyroidism drugs naman, calcitonin, editronate, and quinasalket. Kaya nga yung pangalan ng isa sa mga gamot dyan, calcitonin, because it mimics the thyrocalcitonin, which decreases blood calcium level in the blood kasi itinatago niya yung calcium sa buto. Okay? The next group of drugs are the drugs that affect now the adrenal glands. So again, ang adrenal glands, may glucocorticoid, may mineralocorticoid, and yung third minor, yung sex hormones. When we talk about glucocorticoid, the major glucocorticoid is cortisol. Ang mineralocorticoid naman, major mineralocorticoid is aldosterone. So ang cortisol, napaka-importante din yan for metabolism. Aldosterone, it's a mineral. So, important yan for fluid electrolyte balance also. So, again, maraming klase ng disorders affecting the adrenal glands. No? But let me discuss Addison's disease and Cushing's syndrome very briefly. Ang Addison's disease is hyposecretion of cortisol. Cushing's syndrome is hypersecretion of cortisol. So, kanina, we have mentioned the function of cortisol in our body, which means its hyposecretion and hypersecretion also affects those functions. Major, lalo na sa metabolism ng nutrients na kailangan ng ating cells, growth and reproduction, ganun din. Okay? Ngayon, ano ba yung mga glucocorticoids? Glucocorticoids, cortisol, are steroids. Alright? So, yung mga short-acting, cortisone acetate, hydrocortisone, intermediate-acting, methylprednisolone, prednisone, triamcinolone, and long-acting, beclomethasone, dipropionate, betamethasone, dexamethasone, and paramethasone acetate. I'm sure most of these drugs are very familiar to you because these are steroids. That's why cortisol is a very important hormone that is essential to life. Kasi metabolism, growth and development ang major functions niya. Okay, now, cortisol is a normal hormone of our body which is diurnal. Pag sinabing diurnal, naturally, ang cortisol natin mataas pagkagising natin sa umaga. At kapag patulog ka na sa gabi, normally bumababa ang cortisol level ng katawan. Yun yung rhythm niya sa ating katawan. That's why when you are to give these drugs, usually they are given once a day. No, it is best to follow how is its rhythm in the body. So, ang pinakamagandang oras para magbigay ng mga gamot na ito na once a day kung ibibigay is between 6 to 9 a.m. OD. Kasi naturally, doon mataas ang cortisol ng ating katawan. Alright? Another is usual, no, these steroids cause weight gain. Okay? Also, when you stop these drugs, do not stop it abruptly. It's important that you discontinue it gradually kasi baka naman magkaroon ng adrenal insufficiency bigla-bigla. Okay? So again, watch out for the following adverse effects of the drugs: increased blood sugar, moon face, buffalo hump, doon sa likod, no, para kang may extra pad of tissue sa iyong upper back. Decreased extremity size, muscle wasting, edema, sodium water retention, hypertension, euphoria, psychosis, thin skin with purpura or mga maliliit na petechiae, pasa, increase intraocular pressure, peptic ulcer, growth, retardation. So, very wide range yung adverse effects niya because itself, steroids in our body are also of wide range na function sa ating katawan. Alright? Next, mineralocorticoid, fludrocortisone acetate. So, ang gamot na ito can replace the function of aldosterone. It regulates electrolyte balance. It promotes sodium retention and potassium excretion. And then it also regulates water balance. Now, let us consider also renin and atrial natriuretic peptide. Si renin, no, isa siyang hormone na sinisecrete ng kidney. It's a potent stimulator of aldosterone release. It helps sustain BP. Si ANP naman, hormone released by the heart. It prevents aldosterone release. It also helps sustain the normal cardiac output. So anatomically, may mga hormones tayo which stimulate and prevent aldosterone release para ma-normalize din yung blood pressure, cardiac output, aside from the fluid electrolyte balance in the body. Now, si aminoglutathione, no, it's a glucocorticoid inhibitor. This specifically inhibits glucocorticoid synthesis. And so ano yung tinitreat ng gamot na ito? Yung Cushing syndrome. Okay? Ketoconazole is an antifungal drug which also has an effect when it comes to inhibiting glucocorticoid synthesis. But aminoglutathione is most commonly used for that. There's some considerations. It increases BP, sodium and water retention, kasi nga fluid. no? Electrolyte balance. Watch out for hypokalemia, such as nausea, vomiting, muscular weakness, abdominal distension, paralytic ill use, and even irregular heart rate, because those are the functions of potassium in the body. Taper drug, if to be stopped, which means do not stop it abruptly, dahan-dahan ang paghinto, may cause osteoporosis in older adults, for it promotes calcium loss from the bones. High doses can cause loss of muscle tone and strength, and again, no, isa sa very common na side effect din niya, it can cause suppression of the immune system. Okay? Next is the pancreas. So, ang pancreas ay isang endocrine gland ng ating katawan which secretes insulin, glucagon, somatostatin, and gastrin. Pero, meron din siyang exocrine functions. But when you talk about exocrine functions, ang function niya is digesting the nutrients that we eat for the GI tract, no? Para ma-synthesize siya. So, ito yung mga enzymes. But here, we only talk about the endocrine function. Now, si insulin, ang major hormone na i-discuss natin, plus the glucagon. Diabetes mellitus is a chronic disease resulting from deficient glucose metabolism caused by absent or insufficient insulin from the beta cells of the islets of Langerhans. So, pag meron kang diabetes, may problema ang beta cells ng islets of Langerhans ng pancreas, which means may problem sa secretion ng insulin. Insulin is secreted by beta cells. Glucagon is secreted by alpha cells. So ano yung problema sa beta cells? Either number 1, absent ang insulin, or number 2, insufficient ang insulin. Insulin is important para yung glucose, which is the primary source of heat, can enter the cell. No, our cells need glucose kasi primary source of energy siya. But again, without insulin, kahit nandoon na sa glucose yung kahit nandoon na sa blood, no, yung glucose mo, hindi siya readily papasok ng cell because insulin is like a door which will open, no, for glucose to enter the cell. Kaya kung may absent or insufficient, nandoon lang sa blood yung glucose, tumataas yung blood sugar that will cause hyperglycemia. Okay? Kaya may polyuria, polyphagia, kasi kaya ka laging polydipsia, no? Kaya ka ihi ng ihi, glucose in the blood will find its way out of the body through the urine. Kaya may laging kain ng kain or laging gutom, laging nauuhaw, because if you have no source of energy going into your cell, parang lagi kang walang energy, lagi kang gutom, lagi kang uhaw. Type 1, insulin dependent, which means absent insulin. Juvenile onset, padalas bata nagsa-start, at ito, ang management dito, kailangan talaga insulin. Okay, pag type 2, non-insulin dependent, usually maturity or adult onset, ito yung insufficient insulin. May insulin pero konti. So, hindi laging insulin injection, maaaring gumamit din sila ng mga oral hypoglycemic drugs lang. From the word oral hypoglycemics, pampababa lang ng glucose sa blood. Hindi nila kailangan ng mismo insulin, pero eventually, type 2 patients might require insulin also in the near future. So, tatlo ang basic management dyan. Number 1 is yung gamot. Pwedeng insulin or oral hypoglycemic drugs. Number 2, diet. And number 3, exercise. No? Another is secondary DM from medications and hormonal changes. Kung mapapansin nyo, ang daming mga na-discuss nating gamot previously na dahil side effect ng gamot yung mga insulin condition, so maaari yun yung secondary DM. And third, gestational DM. Ang babaeng ito, pag nabubuntis, doon lang nagkakaroon ng diabetes mellitus. Kasi nagkakaroon ng resistance due to high hormones. Okay, again, that will be discussed further. sa upper years ninyo. Alright? Now, um, if you are giving insulin, no, concentration of insulin is 100 units per ml or 500 units per ml. Ang dosage ng insulin, units. Walang insulin na milligrams. So, units siya. Okay, you roll, you do not shake, especially yung cloudy insulin bottles. Requirements vary. Less insulin with increased exercise, more insulin with infection and fever. Kaya less insulin ka with increased exercise kasi kailangan mo ng more sugar in your blood para hindi ka magutom. More insulin with infection and fever so that makapasok yung maraming glucose into your cell kasi nga meron kang sakit, no? Insulin is a protein destroyed by GI secretions. So walang oral insulin. It's injection. Mostly best absorbed via subcutaneous fats. Okay? Usually given in the morning before breakfast and then given several times a day. So ang insulin, if it is unopened, refrigerated until needed, pero pag nabuksan na, at room temperature, 1 month, pero pag sa rep, pwedeng tumagal until 3 months. Meron din tinatawag na pre-filled syringes. Should be used in 1 to 2 weeks. Pag sinabing pre-filled syringes, binili mo yung insulin, nasa syringe na. I-inject na lang. Side effects, confusion, agitation, tremors, headache, flushing, hunger, weakness, lethargy, fatigue, urticaria, redness, and irritation at injection site. Okay? Ibig sabihin, naramdaman mo ito majority dahil baka naman nag-hypoglycemia ka na. Okay? Yung redness and irritation at injection site, usually kapag meron ka ng lipodystrophy. Ibig sabihin, sa iisang subcutaneous fat na site mo lang ini-inject yung insulin. At dapat ang insulin niro-rotate ang injection sites sa iba-ibang subcutaneous fats na areas. Okay? Maraming fats sa abdomen. No? Pero pwede rin siya sa deltoid, sa buttocks. So, pwedeng i-rotate ang injection sites. May be administered in adjusted doses depending on blood test, glucose result, based on a sliding scale insulin coverage. So, ibig sabihin nito, maaaring hindi regular the same dose lagi. Maaaring nagdedepende ang dose ng insulin niya sa result ng blood sugar niya. Alright? Ngayon, meron ding tinatawag na Somogyi effect and the Dawn phenomenon. So, ito yung mga effects na ng pagbibigay ng gamot. No? Somogyi effect, rapid hypoglycemia when you injected. Usually pre-dawn hours of 2 to 4 a.m. Yung dawn phenomenon naman, hyperglycemia na kasi tulog ka eh. Mas matagal kang tulog, so hindi ka nabigyan agad ng gamot, hyperglycemia with headache, night sweats, and nightmares during the waking hours. Okay? So ito iba-ibang klase ng insulin. Alright? Rapid insulin, Humalog. Short-acting insulin is the regular insulin, Humulin R. Intermediate acting and the long-acting ultralente insulin. So when you say onset, at these minutes to hours, nag-uumpisang bumaba ang blood sugar. Peak, mababa ang blood sugar. So baka makaramdam agad yan ng gutom or hypoglycemia. Duration, tapos na yung effect niya at baka tumaas na naman ang blood sugar. So kailangan ulit ng next dose depending on the blood glucose test. Alright? Now, si regular insulin, lagi siyang dinodraw up first. Because sometimes there are cases na you combine 2 insulins in one injection, in one syringe. Pwede yun, for best results, for longer results, for more effective results. Among all of these drugs, it's only regular insulin which is clear. meaning siya yung parang tubig. The rest of the insulins are cloudy. No, feeling mo, ay ano ba to? Luma na ba yung gamot? Bakit cloudy yung itsura niya? Normal yun. It's only regular insulin which is clear. So if you are to give combinations, you draw up regular insulin first. Okay? Also, si regular insulin lang ang pwedeng ibigay ng IV. Pero comparing it between sub-Q and IV, best route pa rin ang sub-Q. The rest are all sub-Q. Importante din dahil galing siya sa ref, no? Mas magandang nire-ref siya pag na-open na lalo. Importante i-warm din yung drug before you inject it subcutaneously to minimize the skin reactions. So again, I mentioned when you inject, rotate injection site sub-Q to prevent lipodystrophy. Ano rin ang importante dito sa iba-ibang klase ng insulin na ito? Of course, you have to remember na pag nag-inject ako ng Humalog, baka in 30 minutes, gutom na ang pasyente ko. So, importante na in 30 minutes, may naka-ready na food for your patient because hypoglycemia is another problem. Kapag naman hindi mo na-anticipate yung magiging effect because the peak action is very, very fast. Okay? So, watch out for hypoglycemic reaction nga or insulin shock. Ibig sabihin, ang bilis ng effect, no? Nag-hypoglycemia agad siya. Another is diabetic ketoacidosis or hyperglycemic reaction naman na may kakulangan naman ng insulin. So again, both of these will be further discussed sa inyo sa med-surg nursing. But these are what you will watch out for. Whenever you give right away, so hypogly, or late naman yung pagbigay mo, baka naman hyperglycemic reaction siya. So dapat tama lagi ang management when you give insulins. So ito yung mga sites where you can inject subcutaneously. Important to rotate it to prevent lipodystrophy. Next is oral hypoglycemics. Pwede lang to sa mga non-insulin dependent type 2. Pero hindi ibig sabihin nito na ang mga type 2 ay hindi mangangailangan ng insulin injection. Eventually, they will need in the future. No? So ito ay nagpapababa lang ng blood sugar but cannot replace insulin. So first gen, tolbutamide, no? Hindi pwede ang mga gamot na ito like tolbutamide sa mga patient na allergic sa sulfonylureas. Okay? Yung second gen glypeside, yung mga yan naman, important to always monitor pa rin, no, the blood sugar. Non-sulfonylureas, metformin is very, very common. Okay? Yung mga thiazolidines, no? Thiazolidine diones, important naman na i-monitor lagi yung mga liver function tests because hepatotoxic or pag matagalan, delikado sa liver ang mga gamot na ito. Okay? Guidelines for those taking oral hypoglycemics, usually nga, di ba, adult onset siya, 40 years old. Less than 5 years in diagnosis, normal weight, overweight, pwede, fasting blood glucose o yung blood sugar, equal or less than 200 milligrams per deciliter. Kasi kapag more than that, kailangan na niya ng insulin. Ano ba ang normal blood sugar? It's usually 80 to 120 milligrams per deciliter. Less than 40 units of insulin required per day. Kasi pag more than that, no, baka kailangan na talaga ng insulin. Not this oral hypoglycemics. Normal kidney and liver function. Kasi pang matagalan ng insulin or this oral hypoglycemics, no? Chronic disease siya. Insulin might be needed if stress, surgery, or serious infection. Do not ingest alcohol to avoid hypoglycemic reaction. Kaya nga, di ba, kapag umiinom ng alak, madalas may pulutan kasi nagkukos ng hypoglycemia ang alcohol. Orange juice, sugar-containing drinks, hard candy when hypoglycemic reaction occurs. So, importante na laging may ready candy para hindi agad-agad magkaka-problem pag nakaramdam ng gutom. And watch out for vomiting, diarrhea, and rashes. Okay? Si glucagon naman, on the other hand, is a hyperglycemic hormone simulating glycogenolysis. So, si glycogen, nakatago yan sa liver natin, and then it can be converted to glucose during times of need, especially pag may sympathetic nervous system action. Ang glucagon mabilis mag-increase ng blood sugar. Alright? Sub-Q, IM, IV route. So, para naman saan ito? It can treat insulin-induced hypoglycemia when other methods of providing glucose are not effective. Because what's the easiest way to provide glucose? Pakainin ng candy. Painumin ng orange juice. Alright? Pero pag not effective, no, yung mga easiest ways na yon, tas tuloy-tuloy bumababa yung glucose level, this is when you can give glucagon. Alright? Lalo na pag may mga insulin shock. Increases blood glucose, no, within 5 to 20 minutes after you administer it. Usual, ang nausea and vomiting as a side effect when giving glucagon. Okay, so those are the different endocrine drugs.